Hi, welcome to Value Talks. In the last talk in this series, we will look at the trends in the healthcare sector which will enable us to identify compelling reasons for hospitals to collaborate and speed into the future. So let's get into it. We will look at trends in these 5 specific areas and go through each one of them individually to get a clear understanding of the growing need for hospital collaboration. Healthcare is local. The red triangles depict the key healthcare hubs in India, where the density of healthcare delivery is high and increasing rapidly. The green squares depict the other healthcare hubs in the country. So the patients from nearby areas have been flocking to the closest hub for their treatment. The criteria which will govern where the patient goes is going to be largely driven by the quality of healthcare delivery and patient experience. While the most structured players in the industry are quality conscious in their own right, suppliers on the other hand are doing a good job of educating even the smallest hospitals in India who don't have the requisite management expertise. So the mindset of such smaller establishments will switch over much faster than what we can anticipate towards greater infection control and better patient experience. And this switch is even more probable given the fact that such establishments have that critical real estate with them where patient walking in is easy. But the fact is that there are more and more establishments with similar facilities springing around the hubs. This means that patients will now start to go towards the closest local points. This changes the way we look at hubs today as the patient walk-in patterns will change. So the situation in the near future will look something like this. This means that local is getting closer and better. Neighborhood hospitals are high on convenience and therefore patients will prefer going to the nearest hospital. In addition, acceptable quality of healthcare will be accessible in most of the relatively closer centers. This means that the current walk-in patterns will change dramatically. This means that the current catchment pockets for hospitals will shrink and overlap, putting more pressure on the top line of hospitals. This leads us to believe that accessibility of acceptable quality healthcare will be the key driver of profitability for all hospitals. Let's look at the second point now where we understand the uniqueness of this business. Healthcare is business with a cause. Hospitals have to balance the business of healthcare with the social responsibility of treating patients. However, the cause of human life and patient care tilts the balance towards the social responsibility of hospitals to provide quality healthcare to every patient. There is already a law in the US where a hospital cannot deny emergency care to a patient irrespective of whether the patient can afford the treatment. While these laws will take time to be enacted in India, but the fact is that hospitals cannot afford a patient dying on their doorsteps for being denied treatment due to affordability issues. The media will soon start to catch these stories, especially if such instances happen around the big hospital brands in the country. Along with this risk, there is the legal risk which is looming large for the hospitals. If you scan India, Kerala has the highest number of legal cases against hospitals. After Kerala, there is a significant drop in the number of cases reported, which could also be due to lack of visibility of such cases. Another trend that is being witnessed is that hospitals and professionals are increasingly becoming distinct entities while they were one entity earlier. This has compounded the legal risks that hospitals are staring at in the future. Now let's look at the trends due to the fact that the healthcare industry in India is fragmented, where majority of healthcare establishments are less than 30 beds. This disintegrated structure dilutes the scale at which hospitals can operate in the country. This means that in the Indian context, acceptable quality is what matters to the patient and not the best quality. I can call a friend and ask if this treatment or this hospital is fine. Fine is good for me. Why? Well, because this hospital is in the neighborhood, 5 other patients have been treated in the same manner and they are fine. So therefore, this hospital is fine for me. This is what we mean by acceptable quality healthcare. This means that in the near future, smaller hospitals will set the benchmark for acceptable quality of healthcare. Now let's understand the flip side of the structure of this industry. From the supplier's viewpoint, this fragmented structure of the industry adversely impacts the distribution costs of supplying goods to the hospitals. It is not the landed cost of goods that needs to be looked at, but rather the healthcare ecosystem needs to look at the whole cost equation starting from the cost of manufacturing or importing to the country to the point that it is consumed by the patient if we genuinely want to think about affordable healthcare in the future. When we look at the affordability trends, it is clear that every hospital has its pyramid of affordability. In every area, patient affordability is scattered and unpredictable. Every hospital gets its slice of rich and poor, insured and uninsured patients. While insurance is rising in the country, there is still a long way to go before we can achieve 100% patient insurance. While this state continues, every hospital will continue to get its share of the affordability pyramid. As this pyramid becomes bigger, the slice from the top to the bottom is slowly going to penetrate across the country. We can surely put some black marks on the map where things are going to be bad, but for the rest of it, you cannot pick up a slice from the top and say that this is my market, because everyone is looking at this slice to be their market. So irrespective of where your hospital is located, the affordability pyramid is geographically driven and therefore affordability constraints will always be knocking on your door. In a nutshell, this means that all indicators are pointing towards rising cost pressures on hospitals. In addition, there are other factors which are contributing towards increasing costs for hospitals. All hospitals want to be ahead on technology, and high-end technology comes at a price. Patient expectations are rising, which is compelling hospitals to do more with the same resources to meet patient expectations. Soon enough, patient safety standards will take the center stage, which will further increase the cost pressures. Talent and manpower is not going to be easy either. With rising inflation in India, hospitals can expect to pay higher wages in the future. Information technology is a big cost in itself. Most hospitals are refraining from using good information technology because of the associate cost burden, but it will not be long before they will have to shift this mindset to compete with other hospitals. Some of these factors might be controllable, but rising inflation at large is out of control of the hospitals, and this will again lead to an increase in cost for hospitals. So what are we getting at? Well, this is what margins look like for hospitals today. But given the trends that we have identified, we see huge pressures coming from affordability on the top line, and at the bottom line we have got rising costs on each front. This means that margins in the future are going to get knocked down from the current levels. So the net result is that we need to take action on things that are in our control, and it is in our control to focus on cost as a driver and start making sure that we are actually working towards scenarios where instead of building the star in the moon, we are controlling our costs today. We believe that cost is the real driver and differentiator in a fragmented marketplace plagued with affordability constraints. Every step adds to the final landed price. Any of the global companies coming into India will have a national point, then distribution at a regional point and a local point, coupled with a lot of sales spending and promotional spending. All this is cost that is finally built into the landed cost of the product. On the hospital side, we don't even consider the cost of procuring the goods from the supplier. This means that we don't even add the cost associated with product reviews, vendor management, purchase process, right up till stocking and consumption. These are the changes that we don't even focus on today. But can there be effective ways at that level to control costs for the entire healthcare ecosystem? And that's exactly what we need to focus on so that collective action can control the rising costs. Can we bring about systemic changes to things like inventory holding, sales efforts, and negotiation time? Can we influence these factors by coming together? The answer is yes, we can. Value is an information and coordination company. We converge, collect, and empower the Indian healthcare ecosystem to produce reciprocal synergies for all the stakeholders. We have launched Value Health Alliance, a platform that enables hospitals to collaborate and suppliers to gain a gateway for coordinated market access. This platform enables the overall cost of the ecosystem to come down and speeds up modernization of hospitals. In the next talk, we will scope out Value Health Alliance and understand how the alliance helps hospitals and suppliers to create reciprocal synergies. Thank you for listening and see you next time.